myself Dr. RIZWANA practicing obstetrics and gynecology for more than 25 years. Currently the director of Embrace Fertility Center at Prime Care Hospital, Bengaluru. There has been a rise in the incidence of polycystic ovaries in the last few years, and it occurs in about 5 to about 15% of women between the ages of 12 to 45 years. We see polycystic ovaries in all age groups, in adolescents, in women of reproductive age, and even women above 30-35 years of age. Most of the time, people who come with polycystic ovaries, they generally present to the obstetrics and gynec clinic, or they present to the fertility clinic, or even at the dermatology clinic, and some of them would have already gone to general practitioners and done multiple scans. See, when we are treating polycystic ovaries, we need to understand that the treatment of polycystic ovaries depends on the symptoms. When it comes to an adolescent polycystic ovaries, we need to find out whether they are having irregular periods, whether there has been any weight increase, or is there any hirsutism, that is inappropriate facial and body hair, or is there any other skin changes like oily skin, acne. Especially in adolescents, there's a lot of stress and anxiety and depression. We have seen girls with different kinds of symptoms. Some of them may have only come with irregular periods, some of them may come with hirsutism, acne, overweight, or some of them may come with all the symptoms. Whenever we are counseling adolescent polycystic ovaries, we need to assure them that this is a lifestyle disorder, and if they try to reduce their weight, they generally should do well. And if they have irregular periods, say for example they get periods once in 3 to 4 months, then we tell them that you can have at least 6 to 7 periods, say in a year. If it is not happening naturally, they don't have to have 11 to 12 periods in a year. So even if they don't get the periods in about say 2 months, they can artificially induce periods by taking a short course of hormonal medicines. So that way they have an assurance that they are getting their menstruations. Then the other thing is about the acne and hirsutism. If it is a very severe form of acne and hirsutism, we need to check their hormones, that is the androgen level, which is by checking the testosterone levels, and then the LH and the FSH, which are the other hormones related to the ovarian function. If the hirsutism and acne is there along with the irregular periods, then they can be put on medicines which will not only regularize the periods, it will also reduce the hair growth and acne. It's very important to make them understand that whenever medicines like these are taken, the anti-androgens, they need to take it for a minimum period of 6 months to see noticeable change in the reduction of the hair growth. The hair which was thick and dark starts getting lighter and reduces in terms of its growth rate. Then the other things is about the overweight. It is very important for these girls to understand that overeating will lead to obesity and insulin resistance, which is another key hormone in causation of polycystic ovaries. We all know that insulin is important for glucose metabolism. In patients with polycystic ovaries, there is a higher insulin resistance, and thereby the glucose is not metabolized, and there is an increased incidence of developing type 2 diabetes. In a way, obese patients are pre-diabetic. As far as weight reduction is concerned, 50% of the treatment of polycystic ovaries is weight reduction for girls with a higher BMI. So it's very, very important that counseling regularly and monitoring their weight, monitoring their blood sugar in the beginning, and regularly is important. Now, as far as the reproductive women are concerned, infertility is a common problem in women of reproductive age group. So we tell them that because of imbalance in the hormones, the eggs are not produced regularly, and in turn there is no ovulation. So no ovulation is nothing but anovulation. So this is one of the commonest reasons with respect to the ovarian cause of infertility. But the good news is that this is a treatable condition. Various forms of treatment are available for the treatment of polycystic ovaries in women who are trying to conceive, which generally includes medication in the form of tablets. If they do not respond to the tablets, they need to be put on tablets with injections, and if they don't with injections, then they might need injections to stimulate ovulation. A small percentage of patients who are not responding to the regular ovulation induction medications may need surgical treatment, which is called laparoscopic ovarian drilling. Well, in these patients, it's also important that whenever they are planning to conceive, if they are overweight, we again need to tell them to reduce weight so that the medications will work better, the chances of conceiving are better. The third set of patients that have polycystic ovaries are patients who are incidentally detected to have an ultrasound scan. These are asymptomatic polycystic ovary patients who do not have problems related to periods or infertility or other skin changes. What about polycystic ovaries occurring in women after 35 and towards menopause? Generally, they do have the same frequency of periods that they have, but the most important thing here is to inform them that their chances of having type 2 diabetes, hypertension, and dyslipidemia will increase if they are not conscious about their weight, about their eating habits, and regular exercise, walking. It's very important for us to increase the awareness of polycystic ovaries. We are moving out to the new building in the next few months. So there will be a PCOS clinic, integrated clinic between obstetrician gynecologist and the dermatologist, along with a dietitian and a counselor. Right now, let us be PCOS conscious, PCOS aware, and try to prevent the severity of polycystic ovaries. Friends, I hope that you found this video useful, and let's all be more aware and conscious, and hope that we all follow a healthy lifestyle and get more conscious, more aware, and try to prevent as far as possible the symptoms and the long-term sequelae. Thank you.